Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. In this video, we will explain the dental management of patient with history of angina pectoris. Anginal attack that occurs during dental treatment will be covered in another video. We will give a very brief introduction of angina pectoris. For details, see medical literature. Angina is derived from a Greek word meaning a choking sensation. Pectoris is from pectus, that means heart or breast. Angina is a symptom of reversible ischemic heart disease produced when myocardial blood supply cannot be sufficiently increased to meet the increased oxygen requirements that result from coronary artery disease. This condition occurs primarily in men older than age 40 years and is also prevalent in post-menopausal women. The basic disease process is a progressive narrowing or spasm or both of one or more of the coronary arteries. This leads to a mismatch between myocardial oxygen demand and the ability of the coronary arteries to supply oxygen-carrying blood. Myocardial oxygen demand can be increased, for example, by exertion or anxiety. The myocardium becomes ischemic, producing a heavy pressure or squeezing sensation in the patient's substernal region that can radiate into the left shoulder and arm and even into the mandibular region. The patient may complain of an intense sense of being unable to breathe adequately. Stimulation of vagal activity commonly occurs with resulting nausea, sweating, and bradycardia. There are different types of angina pectoris, but the most common are stable angina and unstable angina. The practitioner's responsibility to a patient with an anginal history is to use all available preventive measures, thereby reducing the possibility that the surgical procedure will precipitate an anginal episode. Preventive measures begin with taking a careful history of the patient's angina. The patient should be questioned about the events that tend to precipitate the angina, the frequency, duration, and severity of angina, and the response to medications or diminished activity. The patient's physician can be consulted about the patient's cardiac status. The ambulatory oral surgery procedures are performed if the patient's angina arises only during moderately vigorous exertion and responds readily to rest and oral nitroglycerin administration, and if no recent increase in severity has occurred. The ambulatory oral surgery procedures are usually safe when performed with proper precautions. Electrosurgery should be postponed until a medical consultation is obtained, such as if anginal episodes occur with only minimal exertion, if several doses of nitroglycerin are needed to relieve chest discomfort, or if the patient has unstable angina. Alternatively, the patient can be referred to an oral and maxillofacial surgeon if emergency surgery is necessary. Once the decision is made that the ambulatory elective oral surgery can be safely proceed, the patient with a history of angina should be prepared for surgery, and the patient myocardial oxygen demand should be lowered or prevented from rising. The increased oxygen demand during ambulatory oral surgery is primarily the result of patient anxiety. Thus, an anxiety reduction protocol should be used. Now comes to the steps in the dental management of patient with history of angina. First is consult the patient's physician. Next is an anxiety reduction protocol should be used. The general anxiety reduction protocol mentioned in your textbook should be followed. For example, before appointment, during appointment, non-pharmacologic means of anxiety control. Similarly, pharmacologic means of anxiety control, and finally, after oral surgery. Have nitroglycerin tablets or spray readily available. Use nitroglycerin pre-medication if indicated. Profound local anesthesia is the best means of limiting patient anxiety, although some controversy exists over the use of local anesthetics containing epinephrine in patients with angina. But the benefits, that is a prolonged and effective anesthesia, outweigh the risk. Because pain leads to more anxiety and stress that produce endogenous epinephrine that is more as compared to present in the local anesthetic. Local anesthetic with epinephrine provides prolonged and effective anesthesia, therefore indirectly reduces endogenous epinephrine. However, care should be taken to avoid excessive epinephrine administration by using proper injection techniques. Some clinicians also advise giving no more than 4 ml of a local anesthetic solution with 1 in 100,000 concentration of epinephrine for a total adult dose of 0.04 milligram in any 30-minute period. The use of nitrous oxide or other conscious sedation methods for anxiety control in patients with ischemic heart disease should be considered. Fresh nitroglycerin should be nearby for use when necessary. Before and during surgery, vital signs should be monitored periodically. In addition, regular verbal contact with the patient should be maintained. This is the summary of management of patient with history of angina mentioned in your textbook. Thank you. Have a nice time.